We've added lots of issues: HIV, cancer, food and nutrition, women's health. You'll hear all about this in COVID, and continue at this very moment at this conference to expand not just our vision, but our strength. You are a part of the vision of the center, and you are very much a part of the strength of the center. So we thank you for coming, and we thank you for being a part of the vision and the strength. Our mission reads, to facilitate public health programs and services to benefit communities and people of African descent. And that's not just a statement, it's a commitment that this leadership and this growing staff live by. And we're so glad that you're here to join us in this effort. Again, we say thank you. I would also like to take this time to thank the staff. I don't know how many are in the room, they're out working, but to publicly thank the staff of the center and our distinguished executive director, Mr. Delmonte Jefferson. They are a joy to work with, and you probably already know that, but it helps for them to hear that from the board of directors. So the center, formerly known as NAPTN, implemented the first State of Black Health Biennial Conference in 2018 in Atlanta, Georgia. How many were there? All right. Okay, Atlanta, Georgia, 2018. A regional conference in New Orleans in 2019. How many were there? Few, okay. And then the conference was virtual. Did y'all participate in that virtual 2020 conference? It was off the chart. Wonderful, yeah. And we were able then to hold a regional conference in 2021 in Oakland, California. And the tremendous growth to where we are today, that represents the tremendous growth to where we are today in San Juan, Puerto Rico. And it would not be possible, as you've already heard, without our sponsors. And I would like to, on behalf of the board and the staff, to thank our sponsors, and I want you to name them so you can hear who they are. You see who they are in your program, but I want you to hear who they are. The American Cancer Society, the American Heart Association, the Campaign for Tobacco-Free Kids, Medtronics, Rescue Social Change Group, W.K. Kellogg Foundation, Illumina, give them a hand, the Public Health Law Center, Truth Initiative, Compassion and Choices, ViiV Healthcare, and PACT, which is the CDC HIV program. Let's give all of our sponsors a big hand. I got it. Okay, our title sponsor is the Robert Wood Johnson Foundation. Thank you. We appreciate your long-term commitment to the center. Thank you very much. So welcome to the State of Black Health Conference presented by the Center for Black Health and Equity. Enjoy the conference and be sure to enjoy your time in San Juan. Thank you.
Thank you, Anita. It is important that the State of Black Health amplify the stories and the experiences of our communities. We're here to learn. We're here to learn how we can use our collective power to improve the health of our people, like in towns like Loiza, Puerto Rico. The town of Loiza was settled by members of the Yoruba tribe who were brought to the island from West Africa. Today, the art, the music, the cuisine, the traditions are representative of the customs brought to the island from West Africa. And here to bring remarks are the mayor of Loiza, Julia Nazario, followed by Nelson Colón from Puerto Rico Community Foundation. Ladies and gentlemen, Julia Nazario.
Good morning. Welcome to our beautiful Puerto Rico. My name is Julia Nazario, and I am the mayor of Loiza. We have 82% of our population are Black people. From this point, I'm going to talk in Spanish. Loiza, como les dije, tiene 82% de nuestra población. Es una población negra, con una herencia africana muy marcada y muy orgullosos de ello. Nuestra gente ciertamente carece de muchos recursos. Somos uno de los pueblos con menos recursos económicos en todo Puerto Rico. Hace apenas un mes, el gobierno de Puerto Rico hizo un estudio y Loiza salió el pueblo más vulnerable de todo Puerto Rico. Así que con eso luchamos todos los días. Nosotros contamos con un 330, uno de los mejores en todo el país, y una sala de emergencias que solamente daba servicios cuando llegamos en el 2017 durante el día. Así que durante las noches nuestro pueblo estaba desprovisto de servicios de salud. Ustedes, Israel, ¿alguien está traduciendo lo que yo estoy diciendo? Ah, ok. Pero no todo se entiende el lenguaje de señas. This is a problem because I speak in Spanish and I think that la mayoría can understand me. That's true. So, Eli, you are going to come here and you're going to be you're going to translate, please. Thank you.
Morning. When Mayor Julia Nazario came to the office, there's no emergency services in Loiza, just from 8 a.m. to 5 p.m. And she fight very hard to take this services 24/7.
Dimos una gran lucha. Así que esos son los únicos, that's all the service we have in Loiza for our people. El mayor problema que tenemos hoy, después de Irma, de María, de la pandemia, es el problema de salud mental.
After Hurricane Maria 6 years ago, Hurricane Irma, earthquakes, COVID situation, the pandemic. Actually, the main health issue in Loiza is the mental health.
Con muy pocos servicios en esta área, nos hemos agarrado de la ayuda que nos brindan organizaciones sin fines de lucro.
To fight this situation, Loiza take its services by ONGs, organizations without community organizations, like Taller Salud, Puerto Rico Community Foundation. His president is here, Dr. Nelson Colón. He's going to talk about a little bit about this.
Bien importante que no nos rendimos. Ciertamente, durante la pandemia, sin tener recursos, levantamos nuestra voz y logramos que nuestros encamados fueran vacunados. Lo hicimos el municipio casa por casa.
At the beginning of the pandemic area, Puerto Rico, here in Puerto Rico, Loiza was the first municipality with a few resources to go home by home, checking people to be vaccinated. Especially with the most oldest population.
En Loiza no tenemos muchos recursos, pero nos sobra la gente con deseo de ayudar y nuestra gente negra en Loiza tiene el poder que le falta a muchos del resto de Puerto Rico y es ese deseo de echar para adelante, de superarse y con la ayuda de Dios lo vamos a lograr.
So even if there are not that many resources available for us, our community is special. It's a community that is filled with a desire to go on, to grow, to get better. And that's what makes the difference. And that's why this community is going to be at the start of everything good that's going to happen, God willing.
Muchas gracias por esta actividad. Thanks for this amazing activity. I appreciate the invitation. And next time I'm going to bring my message in English, okay?
Ladies and gentlemen, please welcome Nelson Colón.
Buenos días. She asked me if I need interpretation. Well, buenos días. Maybe I do. Maybe I do. I just want to first thank the Center for Black Health for bringing this conference to Puerto Rico. Conference like this expresses more than the conference itself. It expresses solidarity with the Black community. It creates economic impact. And also give us a sense that we are not isolated. So thank you for being here. I am really deeply honored by the invitation to address this group for several reasons, for a very special one. This conference here reaffirms our sense of belonging as Black people in this region, Black people in the Caribbean, Black people in this hemisphere. And it is important for us to look at us as part of a larger community. So I'm gonna welcome you to 3 Puerto Ricos, not 1, 3 Puerto Ricos. First, I wanna welcome you to the island nation located in the middle of the Caribbean in the hurricane path. And I'm underscoring that just to say that that is part of our life. So we have learned to live with it, and we have learned to overcome it. It is the smallest of the greatest Antilles, and it is the southernmost frontier of the US. Colonized first by Spain for more than 500 years, and in 1898, we became a colony of the US. To this date, we remain a territory with 3.3 million inhabitants. 50% of our economy is based on manufacturing, and the other half on services, including tourism. And let me just make a note that after 2017, after Maria, tourist industry in Puerto Rico was saved by our Afro-American sisters and brothers who flooded Puerto Rico in support, were not afraid. So the profile of the tourists in Puerto Rico changed dramatically with its corresponding racist tension in this town. So thank you to our brothers and sisters who came to our rescue. 39% of the population lives under the poverty level, and Puerto Rico shows the largest inequity gap among all U.S. jurisdictions. The economy has not grown since 2008, and public services are further strapped by the Promise Act that limits the capacity of the government to do public investment. Puerto Rico, I just want to say that there is another Puerto Rico, which is communicated with great dignity by the mayor, Julia Nazario. That is the Black Puerto Rico. And I want to stress that on behalf of that community, I want to welcome you all to that other Puerto Rico. That Puerto Rico is different from the tourist industry promotion, but that is a vibrant, lively Puerto Rico. It is comprised of 286 people and who originated, as Mayor Julia says, from Bantu-speaking people, Yoruba-speaking people, people from the sub-Saharan Africa, and other ethnic groups and nations. After the abolition of slavery in 1873, we mostly settled on the coastal towns on the northeast of Puerto Rico. So I truly invite you to take the route of the Black tradition in Puerto Rico, starting not from here in Carolina and going all the way down to Loiza and from there to other northeastern towns. I just wanted to share with you two research facts. One, a research piece written by Doctors Caraballo and Godreau indicated that the Puerto Ricans of lighter skin have better general health outcomes than Puerto Rican who self-described as being darker. In another study conducted and commissioned by the Puerto Rico Community Foundation, the poverty level for Blacks was 5% higher, 5 percentage points higher than the rest of the population. These two references communicates a very powerful message. The interconnected nature of the problem give us the possibility of addressing the collective answer to its solution. Thirdly, I also want to welcome you to Puerto Rico as a portal to Blacks in Latin America. We are part of 200 million African community in Latin America and North America. That's the number in this hemisphere. 45 in the US, 155 Afro-Latinos in the rest of Latin America. So that is a large community to rely on. In the Puerto Rico Community Foundation, we have launched the Racial Equity Building Institute for the Americas to connect those communities. And I do hope that this group will eventually become part of that larger community. So thank you for being here. Welcome to the Portal for Blacks in Latin America. Welcome to the Black community in Puerto Rico, and welcome to the island nation of Puerto Rico in the Caribbean. Thank you for being here. Welcome.
Thank you, Dr. Colón. Our next speaker needs no introduction. He is the remarkable, fearless leader of the Center for Black Health and Equity, a man who stands in sensible shoes. Put your hands together for Dr. Delmonte Jefferson.
Thank you, Mark. Thank you, Mark. Welcome. Y'all in Puerto Rico, welcome. Yes, yes, let's do it like we know it. Thank you for coming and participating with us in this remarkable event. And it truly is remarkable, you know, just taking all of this in. Our family and friends here in the audience, folks that are supporting everybody committed to saving Black lives and brown lives and populations and making things happen and banning the sale of mentholated tobacco products and banning menthol altogether and working with our brothers and sisters in Puerto Rico. I really loved when Mayor Loiza, when she was speaking, because a lot of folks didn't understand what she was saying, right? Raise your hand. That is indicative of the work that we're doing. We going into communities, y'all. We're trying to save lives and people are talking to us and we don't understand what they're saying. We don't understand. We can't relate, but we've got this objective to pass this policy or to save this life, and we don't understand what they're saying. We don't understand what the problems is. That was indicative. That was powerful. And then she brought a translator up. That was important. When the translator came up, right, and started translating to the funder or to the other person, this is what they're saying, then we understood. Now we can be responsive. Oh, that was a lesson learned. Yeah, some people missed that. It was flying, but I was getting that. I was getting that, and so we're thankful. As Miss Anita said, we started this back in 2018. Talk about that intersection. You know, everybody is working on health equity, and let's save lives and health equity and this chronic disease disparity here and this chronic disease disparity there. But they weren't talking about how it was tied into the social injustices that was going on. Killing Black boys, young Black men without a reason, stopping them, frisking them, putting them in jail. Well, that impacts your health. As Mayor Loiza said, that impacts your mental health, your physical and your stressful health. That impacts it. And so you got to look at that intersection of social injustices. But you also got to look at economic empowerment, as again, they were sharing from Loiza, the economic empowerment, not having the resources to get that health care that you might need. So how you're going to have health equity and advance health equity if you're not looking at, can people afford that health equity? Can they afford it? So there's an intersection, and that's what this conference was started. It was started to talk about that intersection of chronic disease and social injustice and economic empowerment. And so a lot of the themes, the breakout sessions, which by the way is just slam packed with wonderful opportunities. I don't know how you're going to decide which ones to go to because it's just slam packed with good sessions on those topics: chronic disease, social injustice, and economic empowerment. So you're going to keep hearing more and more about that. But, you know, this year was a rough year. We lost a couple of our colleagues, of folks that have been working, folks that have been attending this State of Black Health Conference and been here with us since the beginning and been here doing this work since the beginning. And we wanted to bring the spirit of those ancestors into the room. Louis McTush, a lot of you know him, you've worked with him. He passed away cancer this past year. But his wife and his daughter are here. Teresa McTush, Yolanda Brown, where are you? Where are you? Right there. Stand up, stand up. We just want to recognize you again. I know we recognized you guys yesterday, but we wanted to recognize you and thank you for coming and being a part of this conference and hanging out with us. Thank you. We appreciate the work that Mr. McTush did for us. We had a work colleague, Margot Dawson, who also passed away this year of cancer. July, I think, she passed away. And so it was hard on the center because we'd never lost a colleague like that before, but you know, that's part of life. That's what happens. And so Jordan Dawson, are you here, Jordan? Come on up, Jordan. We, this is her son, Jordan Dawson. And we did, come on up, son. How you doing? We drafted a resolution for Margot. And it reads, we, the Board of Directors and the employees of the Center for Black Health and Equity wish to express our sincere gratitude and respect for our colleague, Margot Dawson. Her passion for education and ensuring equitable health outcomes for her people, our people, endeared her in our hearts. Whereas the Board of Directors and all employees of the Center for Black Health and Equity would like to express our sympathy and condolences to her family. We would like you to know that you are all in our thoughts and prayers, and whereas Margot Dawson was a great contributor to the mission of the Center for Black Health and Equity, and whereas Margot Dawson worked with the diligence and vigor to achieve the goals and objectives of the Center for Black Health and Equity, and whereas Margot Dawson lived in such a manner to touch each and every one of us with her great example of passion and dedication to the work of the Center for Black Health and Equity, therefore be it resolved that the legacy of Margot Dawson will be remembered and honored at the Center for Black Health and Equity as we continue to do the great work that she demonstrated as an employee of the Center for Black Health and Equity, humbly submitted to the family of Margot Dawson by the Center for Black Health and Equity at the State of Black Health in San Juan, Puerto Rico, on this 7th day of September in the year 2023. Thank you, sir. Please, sorry.
Wow. Wow, this is really amazing. Thank you so much. I just wanted to say one thing to the center, to everybody here. My family, we were battling this for 9 years. And as you mentioned in that beautiful writing, my mother was very passionate about our people, about our youth. And I call my mother the sun, and the sun was very bright. I always remember the sun being strong and bright. And the light got dimmed by this fight, and she was forced to step back from a lot of the things that she was so focused on her whole life. A lot of the things that she instilled in my 2 other siblings, inspired in my father. And we're so appreciative of this organization because towards the end of her fight, she was able to feel like a soldier again. So we accept this humbly, we accept it with love. Thank you so much to everybody in this room. You're doing so much. Your colleagues your work doesn't go unnoticed. The families, we notice, and the communities notice. Thank you very much.
We learn from our elders, we learn from our ancestors. We don't want to wait until they've passed away to honor them, however. And in this room here, we have elders and ancestors. In fact, a couple of the founding members of the organization, the Center for Black Health and Equity, are in the room. Ms. Brenda Bell Caffey, over here, one of our board members, was one of the founders of the organization. And another founder of the Center for Black Health and Equity is also in the room, but not just of the Center for Black Health and Equity. That whole movement from the CDC to address priority populations, to include their voices and their words in this fight is in this room. That's Dr. Bob Robinson. And we want to honor this elder and have him come up and say just a few words to us. Dr. Bob, please.
Thank you, Delmonte. The title of this presentation is called Eliminating Population Disparities, the Conundrum of Science and the Importance of Race and Community. And it's based on the core assumption that we all are here as a collective to eliminate disparities. African Americans eliminated the 50-year-old Black-white disparity in tobacco use prevalence in 2001. The victory was short-lived, but the vital lesson was the importance of a comprehensive array of public health interventions. These interventions included behavior change, policy, health promotion, communication, media advocacy, and most importantly, community-focused development initiatives. In addition to comprehensiveness, there is a strategic and tactical goal that I recommend pursuing. In regard to strategic, we need a paradigm shift in scientific theory and methodology. We must transition from a focus on the individual to a focus on the collective reality of race and community. In regard to tactical, we need to control the narrative. In general, we need to deprioritize the scientific rules that result in reductionism and focus on the underlying complexity of race and community. The challenge is, while succeeding in recognizing race and community as social constructs, we have failed to define or explain what we mean by race and community. The consequence is a science insufficient to meet the requisites of eliminating disparities. James Baldwin, in an essay he began to write while visiting San Juan in 1964, titled "Nothing Personal," stated the following, and I quote, "We live by lies, and not only, for example, about race. Whatever by this time, in this country, or indeed in the world, this word may mean," end quote. The absence of meaning, which Baldwin implies is an absence of self-love, has plagued us for decades. We did not understand race in 1964, and we do not understand race in 2023. It is no wonder that our science has not been up to the task of understanding race. Leonard Syme, an eminent social epidemiologist at the University of California, Berkeley, has stated that the scientific literature lacks evidence of effective interventions applied to community. Indeed, if our theory is insufficient, then so will be our methodology. And if both theory and methodology is insufficient, then so is our science and the interventions produced. And the people paying the biggest price for these insufficiencies are those experiencing disparities. So in regard to the paradigm shift, W.E.B. Du Bois said at the first Pan-African Conference in 1900 that the problem of the 20th century was the color line. I suggest that the problem of the 21st century is the limited development of the social construct, a failure to define race and community. 1, the responsibility for our failure to advance theory and methodology related to a rigorous definition of race and community rests in the failure of African American scientists and intellectuals to meet the challenge. 2, Frantz Fanon, in Wretched of the Earth, referenced the inability of the emergent bourgeoisie to overcome the indoctrination of colonialism. Instead of original thought our leadership succumbed to the rewards associated with assimilation and replication. A replication grounded not in creativity, but in mediocrity. In essence, it is a failure of self-determination, of purpose. 3, race and community are social constructs, yet we have not advanced the ideas beyond the framework of a social construct. What does race mean? Far too many of our colleagues have been satisfied with the principle that race is not biology and have centered their work on the negation of racism. The 21st century requires, indeed demands, a higher standard of analysis. And what we do not realize is that a failure to define race is also a failure to define community. 4, the community model, published in 2003, states that the core determinants of race and community are history, culture, context, and geography. Our challenge is to create a methodology of observation and analysis that equates with this complexity. And a requisite of the community model is not the behavior of the individual, but the development needs and assets of the community. 5, and there is a secret to the intersection of race and community. In terms of public health, race is only important in terms of community. We live in a nation primarily of communities organized by race and ethnicity, and to a lesser degree by religion and gender sexual identity. Professionals pursuing the medical model are free to pursue individuals in terms of their race or ethnicity, and even focus on biology if it has ideological significance. However, as public health professionals, our focus is the collective. Before we move on, history is a good example of why we must pay attention to the core determinants of race and community. We turn once again to Baldwin, still in San Juan, and most assuredly reflecting on the recent assassination of Medgar Evers. He wrote of the dilemma of not acknowledging our history, and I quote, "To be locked in the past means, in effect, that one has no past, since one can never access it or use it. And if one cannot use the past, one cannot function in the present, and so one can never be free." I take this to be, as I say, the American situation in relief, the root of our unadmitted sorrow, and the very key to our crisis, end quote. And from a public health perspective, we are in a crisis. We live in a nation that leads the world in inequality. And we have a science totally unequal to the challenge of offering solutions. And absent a paradigm shift, we will continue to fail. In regard to controlling the narrative, 1, a documentary about the Reverend Al Sharpton reiterated the importance of controlling the narrative. Indeed, it is a basic rule in community organizing and advocacy. To control the narrative is to define the terms of the debate, and importantly, the goals of the advocacy. I would add that it is also necessary to comprehend the boundaries or the parameters inherent in the chosen language. 2, affirmative action is a prime example. First, what are the parameters? Affirmative action functions as a tool of diversity. Doors are opened and individuals enter. Individuals enter, not the community. Affirmative action has always served as a mechanism for distributing what Du Bois framed as the talented 10%. It has never been a mechanism for eliminating population disparities. 3, the Supreme Court, urged on by right-wing conservative ideologues, has transformed affirmative action into the problem. The effort to undo racism has been stood on its head and is now an example of racism. 3, the same potential exists for equity. What was once defined as eliminating disparities has been transformed into achieving equity. I empathize with the reasoning. It is a choice of focusing on goals grounded in the negativity of disparities versus the positive ethos of equity. 5, the danger is that every goal associated with equity is not necessarily relevant to eliminating disparities. For example, equal access to medical care, while positive, will have limited impact on disparities because we know that healthcare is only part of the solution. The attention given to equity may involve inattention to disparities. 6, and who can predict when the Supreme Court, governed by ideology and irrationality, will make the pursuit of equity the problem? I'm not suggesting that we relinquish present terminology. I am suggesting we be conscious of the implications of language and how it may enhance or diminish our ability to control the narrative. In conclusion, disparities can only be eliminated by interventions focused on community. And community can only be understood by grappling with complexity. This work is being advanced by the Center for Black Health and Equity, and their work on formulating training materials centered on an understanding of community, the importance of community development, and a conceptual framework that defines prevention, not based on successful upstream applications targeting epidemics or behavior change, but on the necessities of development and building on existing assets. I urge you to look for the Health Justice Guide that will be published shortly, and I urge funders and leaders of policy and program development to support these efforts. Thank you.
There is wisdom in our elders, y'all. You see why we brought them out of retirement now. We brought them out of retirement to help us with this. There's wisdom in our elders. Tap into it. I would encourage you. If you think that was something, we're about to hear from Shavon Arline-Bradley. I don't know who knows her. I don't know who knows her. Some folks know her. And so you are in for a treat. She is president of the National Council for Negro Women, but she's also the founding and principal of Reach Beyond Solutions, a strategy and innovation consulting firm. And that's where I first met her. And she has been brightening me with her wisdom and her thoughts ever since. Let's give a warm State of Black Health welcome to our keynote address this morning from Reverend Shavon Arline-Bradley.
Well, first of all, I don't know why I'm here after that keynote we just had. In church, we would say, well, this is the day the Lord has made. We'll just keep on talking about something else. If there is a plate to be passed, it should be passed right now. I stand a bit overwhelmed. I'm a Black woman in America. I stand a bit overwhelmed because I'm sitting in the seat of Mary McLeod Bethune. I stand a bit overwhelmed because of Dorothy Irene Height. And I stand overwhelmed as a Black mother of a Black boy in America. And so my acknowledgments will start with this center, because when you're a public health person in civil rights, it's a bit of an anomaly. I'm leading one of the oldest Black civil rights organizations in the country, but public health people are not normally in that space. I don't know about you, if you have an MPH or went through public health school, if you're like me, and my daddy said, well, what do they do? What do you do? It's like, Dad, I'm in population health. I'm serious. I have Epi. Yeah, he said, yeah, well, what do you do? And then 2020 happened. And all of a sudden people said, where's our epidemiologist? Where's the public health community? And I'm telling them they should have met us in Puerto Rico, because this is the public health community in this room. And I'm grateful for the center and for its leaders. My husband is with me. I believe in Black love, and I believe that there are spaces and places that we disconnect from it. Our anniversary is this weekend, so I was like, yeah, Delmonte, I'm coming, and I'm bringing my husband with me. Amen, amen. So we have no children in the ocean. Hallelujah, somebody. Y'all pray for my parents. They got that boy right now. As the president and CEO of the National Council of Negro Women, I know there's some section members who are here. I am pleased to say to you that NCNW is here in partnership with you. I am pleased to see all the sisters. If you're a part of the Divine Nine, you are part of the National Council of Negro Women. Shout it all out. Now you see what I'm wearing. You see what I'm wearing. But I'm a member of all of this sisterhood love that we have in this room. And for sidebar, we are hiring, so I do need some MPHs on our team. So go to ncnw.org and then see me after if you have some people that need some jobs. Follow us on social media. I want to say this because I want to break the ice this morning. And those that know me know I'm a walker, but I'm going to stand here because I want to read this break the ice moment. And I found something online that struck me and let me know that I'm a little bit old school. I'm fine to be 45, but I'm a little bit old school. But I want to see who's in the room if you're a little bit old school with me. All right. So what I want you to do is raise your hand if you answer yes to this question. All right. Raise your hand if you answer yes to this question. I'm just trying to get a sense of who's in the room. If you graduated from an HBCU, raise your hand. All right. Oh, look at y'all. They're like, ooh. Look at the church. They're like, yes. If you graduated from a predominantly white institution, raise your hand. If you have a degree from both, raise your hand. That's us in the room. That's us in the room. Different experiences, right? Look at it and you're like, If you claim to be a Southerner from the southern part of the United States, from Virginia on down to Florida, over to Louisiana, Mississippi, go raise your hand for folks down south in the room. All right. Any Midwesterners in the house? Come on, man. Come on, Midwest is strong. How about West Coast folks? Folks on the West Coast? In the building. And I'm a Jersey girl. Any East Coast folks in the house? Any East Coast folks? All right, I see. All right. Another question. How many of you have ever had to use a rotary phone? Ooh, you might be old school. Ooh, look at young people like, what the heck is a? You ain't been to a black mama's house unless you had to do the. How many of you listened to a mixtape that you made before? All right, I'm in the right house. I'm in the right house. I'm in the right house. All right. How many of you learned cursive in elementary school? Mm-hmm. All right. How many of you had to use an encyclopedia before? I knew I would get the researchers for that one. All right, I got two more. How many of you have ever had to use a paper map for directions? Look at the hands and shake. They're like, oh, wait a minute. Uh-huh. And here's my favorite one. How many of you ever had a MySpace account? They're like, wait a minute, you go too far, Shavon. You go, look at you, I see you. All the MySpace folks in the house. Uh-huh. All right, I wanted to get a sense who's in the room today. My charge today is to really give you context on the state of Black health from my framework. And when I had the preparation conversation, I'm a preacher. Let me go ahead and just tell you right now. So I am looking at the clock, but I'm really ignoring the clock. I just want to go ahead and say that right now. All right. It's not even moving. So I know we're on the same page. But in the conversation, we talked about it. She said, look, sis, I need you to talk a little bit about the history. I need you to give context about social and political climate. I want to hear policy solutions. I need you to talk about NCNW and the importance of the village. I said, well, am I the entire conference? So I'm going to pack that all in this small time that I have. But I want to start with a story. It just happened 1 month ago. In August of 2023, if you are an African-American in this country and you hear the words, well, I went to the museum, you know which museum I'm talking about. It is the museum. For my friends that are not African-American, don't worry, we're going to tell you in a second what the museum is. For us, it is the African-American History Museum. There's only one museum that we say the museum about, because for us, 400 years of recollecting the realities of Blackness in this country. The museum is the place where it starts to begin to tell a real story. And that weekend, my husband and I, my best friends came in town. One of my best friends, so funny, we had the Divine Nine, AKA Delta, we got our little ones with us. We got into the museum, and if you don't know anything about the museum, the first floor is the basement. You go to the basement, and the lighting changes. It's dark in the basement. It's dark. It's dark because it's beginning to paint the picture of the reality of what it looked like to go through the point of no return. And we walked into the darkness. And at the same time we were walking, my phone was buzzing, and my good girlfriend, Dr. Tamar Bryan-Davis, I don't know if you know her, but she is the president, first Black woman ever to be the president of the American Psychological Association. It's amazing. She was texting me at the same time I was going into the darkness. And I'm like, I might need a psychologist after this experience with these, because we had little children with us. They were 8 and 9. My child is 9. And my niece, Demi, is 8. She started tapping. She started to rub. And I realized something. Psychology is an intersection between physiology and philosophy. And I realized she was having a reaction to the darkness of slavery. She saw the shackles, if you ever seen it. Go see the shackles of the babies. I might cry. Because the shackles of the babies let me know what was happening to this 8-year-old right in my face. She was having a physiologic reaction to pain, to racism, to sexism, that she didn't even know how to articulate, but how to tap. And she said, Auntie, take me out of the darkness. That's the title today. We got to get out of the darkness. I have constantly gone to public health events and meetings and seen slides that have had every graph of every map. So here's my slide. That's all you're getting today. That's my slide for the day. Because I'm done with slides. I'm getting us out of the darkness because the context for our history has been lost. Sometimes you got to repaint the picture for people that are making decisions for your people to help them understand what it means to be in the basement. The darkness is the realities of being Black in this country, is that your history is the only one on question about to be erased legally. How evil can you be to try to remove an entire history of a people? A history that without you would be no one. You would be no country. You would have no White House. You would have no access. And if it wasn't for the basement, it'd be a different story. There's a brother, Dr. Reese, who's out of University of Texas. His name is Robert Reese, and he's at the Population Research Center, University of Texas at Austin. And there's a beautiful policy brief that was done in the last summer, and it's entitled Life Expectancy for Black People Living in Former Slave Counties. I read the brief, and he says that the work that was done in some of these counties where there were enslaved people in 1860, now 3 years from emancipation, 5 years from the reality for some, relative to counties with fewer enslaved people in 1860, those counties that had more enslaved people in 1860, listen, have a lower Black life expectancy in 2022. I want you to walk with me from the basement. If you forget your history, you'll begin to do consistent activities that still haven't worked, because in 2023, I'm still talking about the state of Black health. If public health practice has been as progressive as she says she is, I'd see more tenured professors in public health schools. I'd see more research funded for more than a year for pilot. I'd see more commitment from those that may or may not look like us, but attempt to say they're allied with us. Dr. Reese was on to something when he found that enslavement is aligned with life expectancy 200 years later. And so the state of Black health for me is coming out of the basement. It's connected to me understanding this history. And if you are a public health person in this room, and I told Daniel this, Daniel's my brother, and we laughed about this. I'm still mad at my MPH professors. I'm mad. Because I went out in the field and started trying to do these theories. And I was committed. I had you knew MPH, I had my book out. It's like, self-efficacy. I used all of them. It's shady. That's I'm in your face with my shade today. I was mad at them. Because what they didn't tell me was that when you go into the real world, their context is driven by the basement. So how can I serve when they don't understand the basement? Now, there's one theory I fool with, though. That's the social ecological framework. Let me tell you why. Because that's the one frame that allows you to think about every layer of your life. And if you're Black in America, you got layers. That's why I ask who's here from the South, who's here from the West Coast, who's here from the Midwest, from the East Coast. Why? Because we all got basement background. Don't play with me. Just because I'm from New Jersey, my people are from Florida and South Carolina. Just because you're from California, most of y'all came from Louisiana and Texas. Just because you're from Chicago, most of you came from Mississippi. And let's really be honest, all of us came from Western Africa. So I want to give context to the basement. And so when I thought about my public health practice and my theories, I had my own moment with God yesterday. Because when you come and see that water, think about the ship. every mother that said, I'm not gonna let my baby come here, who laid their lives into the water because of a clear, conscious choice to stay free. And so I said, God, give me a connection between public health and history. And he was so smooth. God talks to me. I'm listen. Tell you what he said. He said, Shavon, you know that slavery is really MPH 101. Maternal and child health. For every slave woman that had a baby on Tuesday and was in the field by Wednesday morning. Food scarcity. For every scrap of pig that my people figured out how to make cuisine. Physical exertion versus physical activity. I have a degree in exercise physiology. That wasn't a physical activity choice. That was physical exertion and labor. And physical exertion and labor killed most of our people, but they were able to prosper because their bodies were actually physically active, but they didn't understand the realities of the public health crisis. Violence as a public health issue. MPH 101, right there on the plantation, lynchings, overseers, whippings, rape and beatings. But yet in 2023, I can say the same thing, lynchings, beatings, overseers, intended to protect and serve, and yet they serve and protect their own interests. MPH 101 is on the plantation. My brother wrote a book, Political Determinants of Health. But I'm gonna talk about social and political determinants of health because on the plantation, they learned legal segregation. And it has continued to trickle into present day voter suppression. Medical apartheid, when being a woman could be a pre-existing condition. Police brutality. And yet and still, they want to erase the history. And I realize that the basement is the most dangerous place for America to see, because if we figure out how to use the basement to create power, don't miss that. Using the context of what we did in the basement, learning how to survive even after the basement. This is why America fears Black educated people. Because you've learned how to use the basement to create a basis for your own plans. And if you're really serious about your resilience, you understand that it's something greater than us that has brought us from that to be able to be in a room in Puerto Rico in the Marriott with nobody having any questions about why we're here. It's the basement. So the social and political climate you want to talk about, and I said, listen, all I got to do is say a few words. I want you to react. I'm Baptist. I need a reaction. I need to know. I need to know where we are. COVID. Breonna Taylor. Ahmaud Arbery. George Floyd. Insurrection. Dobbs decision. Tyree Nichols. And let me stay there. Context of being Black in America and being killed by Black officers is such a conundrum to me, because what it really shows me is that white supremacist context even sits in the heart of our own people. And for those that are white in this room, this is not about you individually. It is about the context of an American system that seeks to continue to advance supremacy, which is evil, which is anti-Semitic, anti-Black, anti-same gender loving, anti-woman. That's what it is. And so, yes, I was just as mad as those officers as I was those that shot Breonna Taylor. Buffalo. Jacksonville. You mean we couldn't even come to the conference without 3 people dying because they're Black at the hands of a white supremacist? Medicaid unwinding. I call it political purging. Affirmative action. You need another list? I think not. Because the social and political context of our country has changed the way we do our work. But it has also harmed us. For those of us that were in DC during the Obama years, we called that Black Renaissance too. There was more happy hours between 2008 Listen, between 2008 and 2016, the Renaissance was out of control. Chocolate City was more chocolate than it had ever been. Aretha Franklin sang at the inauguration. What more do you want? This is what I found, that the danger of comfort has seeped into a people. The danger of comfort and access has seeped into a people. There used to be a time that when I saw you and I did that, you already knew I had you. We've turned into a society, even in public health circles, where your tenure is more important than your people. And I say the devil is a liar. As sure as I am Shavon Louise Arline-Bradley, named after my grandmother, I tell you this. The social and political climate of this country is calling for a public health workforce that understands its role in the war. We're at war. This is why I want to talk about laying down the law. This is the policies and strategies that have worked. I was there when Daniel Dawes was behind some of those doors, thinking about that Patient Protection and Affordable Care Act. I was there when the president signed it into law and then got hate mail the next day in my office. I was working for the NAACP. My husband will tell you we were newlyweds. The FBI called back and said, yeah, they're threatening to kill y'all about health care. Now, first of all, I'm from Camden, so I was put out. What you want? I'm Jesus and loaded. I'm both. I do both. Jesus and load. I wanted it. That was before we had Mike. I had a little bit wild then. But in the context of the Patient Protection and Affordable Care Act, I refuse to call the Obamacare because I realize the ignorance of a people is what takes them out. That's why I say Patient Protection and Affordable Care Act. That is still legislation. It is still the land and the law. It is still in place. And it took public health people behind the scenes to change the country, but yet instill political pundits and partisanship intend to even take that out. You think affirmative action is an issue? You wait until they come after the ACA again. I'm telling you right here, right now, as sure as it is, we are in Puerto Rico and they're coming for ACA, I promise you. The infrastructure bill. How many here from Mississippi? Holler me. See me after this. The Affordable Connectivity Program is inside the infrastructure bill. I want to tell my public health people something. Please get familiar with legislation. Do not let a day go by when a new piece of legislation is passed, because guess what? Hidden under the bricks is the reality of where the money is supposed to go. I'm calling out Mississippi because NCNW is about to work with the FCC to make sure we get Black people connected to the digital broadband in the area. And in the bill of infrastructure bill, the Affordable Connectivity Program actually lies. The problem is we haven't been able to track where the money's going because many governors in certain states have opted not to put the money on the ground. And my problem is with the public health people, you so one-track mind about your program, you've not been able to branch out and start thinking about where you activate your power. I'm saying get out of the basement. Activate your power. And listen, we're not going to all agree. Listen, we are not all on the same page. I'm okay with that. If you walk into a room of Black folks, people are so confused by that. They think we are all the same, don't they? I'm like, I mean, we're not a monolith, but we should be intentional. I don't care if you're a Republican or a Democrat. I don't owe neither party nothing. And neither do you. Don't get locked in partisanship. Get locked in people power. Get locked in people and political power. Why? Because if I could get another MPH in Congress, I bet you things would change. All right, you don't like it, it's fine. I'm going home anyway. The Inflation Reduction Act, policies that have been working, I see my time. It's supposed to benefit those that are from Medicare that are going to be able to negotiate prescription drug prices. Now, I want you to hear this. The leader of CMS is a Black woman. I'm about to say her name, so y'all don't trip. A Black woman, Chiquita Brooks LaSure, Jersey girl, sister among sisters, is literally fighting for her life in this position because she is advancing equity for all people. But her consciousness has not left Black people. Her assignment is all people, but her consciousness is to her people. And that's the challenge that we have to deal with. I'm telling you that CMS is under attack. Why? Because this sister is in charge of billions of dollars. And it excites me every time she walks. I stand up when she walks in the room. Not because she's my friend, but because I know that the stripes on her back are heavy. Because she got fools around her that are in the basement. But what more can we do? NCNW has committed to this. Good Health Wins is a program that we have that's been funded by the CDC. It stands for Good Health Wins Immunization Network. It's about building an army of health champions, but I'm gonna tell you what we're really dealing with, and that's the community of practice. Let me tell you something about Black organizational leadership. Do not disconnect from fellowship in Black health. Let me say it again to you. We are stronger as this collective fist. You may not agree, but stop complaining on the sidelines, join the organization, and give your insights. I'm going to tell you why. Mary McLeod Bethune in 1935, who was the founder of the National Council of Negro Women, called a meeting in New York City. She was a Delta, but she knew she needed more than just her sorors. So she called every Black women's club that was founded by 1935. 30 women showed up for that meeting as heads. So the whole Divine Nine Sisters, I'm calling all of y'all sorors, we were all in the building. We were all in the building with the church women. We were all in the building with the business women. Why? Because she understood collective Black woman's power. And I'm saying to you today that NCNW is revisiting collective Black woman's power. We are going to push the core for healthcare, education, economics, and social justice. Why? Because without any of these, you're nothing in this country. You say you want to be healthy, but you don't have any funds. You say you don't have any funds, you don't have any education. And then you have no context for civic engagement because the schools are taking it out of schools. So NCNW is here to work this. I've got a few more minutes. I want to talk about what we need to do. We need the village, my friends. Let me alert you to something. In public health, they use this term often. And many of you know my background is in public health, but I also have been in civil rights organizations. After I left the NAACP, a man named Vivek Murthy called me. He is the current United States Surgeon General. He was also Surgeon General for Barack Obama. True story, I hung up on him. I thought it was a prank. I was like, man, stop playing. He called me back and said, I really want you to work with me. I said, I'm so sorry. You're not trying to play. I'm so sorry. One of the things he said to me, Shavon, was, I am hopeful that we can advance this apolitical agenda. You know the words apolitical. It's one word, apolitical. The context for apolitical is that you're supposed to be able to do things without politics getting in the way. But then 2016 happened. And I watched them walk my boss out of a building with armed guards. And apolitical went right out the door for me. Let me tell you something about you as public health people. We are apolitical, always political. That's what the A means for me to you. When an administration changes, many jobs change. Always political. Public health practices are affected when policymakers that have diverse approaches govern and are in power. But I'm a hip hop junkie. You haven't noticed? Money, Power, and Respect was one of my favorite songs by Little Kim. She was a prophet as far as I was concerned. I knew what happened when she said money, power, respect, because it all changed because COVID let us know that money, power, and respect really decides who gets access to care, who doesn't. She didn't know she was preaching to the public health community. Money, power, respect. Money because resources are required. Power because many of us don't have enough. And respect, they don't respect our craft. But here's what I want to say to you. Public health, you are the special sauce of American culture. You are the special sauce of American political context. And public health has to work on her public image. Public image is thwarted. It seems to be so light in research, but they don't understand that the research is the ammunition to be able to change things. If you are a researcher, please raise your hand. Hold your right hand up. Because when you hold your right hand up, you're going to vow to do something. I want you to vow to never leave Black stories on the table. I want you to keep your hand up and vow that you will never stop collecting data. I want you to vow that you will never stop pushing until you get more DRPHs and PhDs on your team. I want you to vow to commit to the academy and then keep your people with you in the academy. My researchers, if you're in community health, raise your hand. If you're a practitioner, if you are a nurse, doctor, whatever, raise your hand. If you're serving people, I want you to take a pledge with me. I vow to look at everyone the same. And I vow when I see my people, I don't leave my people. I vow to give service better than I've given it yesterday or whatever. And let me say this to you that have served the people. You are the front line to change lives. Why are you so important? This is my close. You're so important because you are the reason why people either leave or go from this system we call healthcare. And the researcher is the ammunition for the war. But the researcher and the practitioner have not talked enough because we've been still dealing with the basement. You got a PhD, you better than me. No, baby. You need me to translate for you what you're doing. And researcher knows, listen, you need me to give you ammunition to how to talk to these legislators on how to change these policies so that Black people will continue to live in America. So those that are in the room that call themselves allies, let me talk to you. The church has already backed me. They're like, Let me tell you about allyship. Allyship has become a fancy word to make people feel good about themselves, to make you be less uncomfortable when we start talking about Black and Blackness and white supremacy in context. So I'm going to tell you what allyship is to me. Now, I'm a preacher, so I did a little bit of a play with it. A is action-driven. Action-driven L, leaders. That L, lend their power, and I, investments, into E, equity, driven strategies and efforts until all communities experience the benefits of S, systematic change in this country. I'm gonna say it again. Go ahead and tweet it. Just hit me up at Shavon Arline so I can get my shout out. Thank you. And tag NCNW while you're at it. Action-driven leaders that lend their power and investments into equity-driven strategies and efforts until all communities experience the benefits of systemic and systematic change in the United States of America. You want to be an ally? Put your money, your resources, your power, your privilege where your mouth is. You want to be my ally? When I come crying to you, that does not mean you need to save me. That means you need to make space for me. You don't have to save me, just make space for me. When I come telling you I don't want to be the only Black person talking about how I feel right now, back up off me. Because I'm telling you, I've been living in the basement for 400 years, and I'm still in a basement in 2023. And I need my ally friends around the table to understand you do have a role in this movement. There was no civil rights movement without Jewish people, without white people, without the faith community. There was no disconnect without us. And the beauty of Dr. Hyde in that moment was that she was the only woman in the house. They didn't let her speak at the march she planned. That sound familiar? Your program comes before The provost? Uh-huh. So let's close out with the village's responsibility. Public health people in the room, the state of Black health can only change when you decide you want to run for office. There's not one MPH right now sitting as a senator or a congressional leader right now. We have a nurse, Lauren Underwood. I am saying to you, if we don't get activated in advocacy and political power, public health will still be an anomaly that you need when there's another pandemic. Till we want to see systems change, you've got to be in the office. That leads me to my second thing in my close. Advocacy is not just an anomaly, it's an assignment. Stop being afraid of politics. You're not going to lose your funding when you talk about facts. You lose your funding when you talk about partisanship and endorsing a candidate. The importance of advocacy, listen, means to educate and advocate on issues that you know will save your people. So if there are people who don't agree with your advocacy, cool. That's not an endorsement, it's the facts. Philanthropy. Your tools are essential. Your resources are essential. But let me tell you what's most essential, your mouthpiece. Your pulpit is amazing. Dr. Best, I want to thank you. Robert Wood Johnson just supported the National Council of Negro Women. And I believe, probably because I got a big mouth and I understand that. But I also believe that the foundation realizes and is realizing the realities of what's happening on the ground. And I'm calling up and calling out philanthropy right now. Stop hiding behind your dollars and use your pulpit to change this country's trajectory today. You know what doesn't work, so stop funding what doesn't work because that institution has gotten funding for 30 years. Fund the organizations and institutions, Black ones too, that have been committed to the work of the people since its inception. Faith leaders are missing in this space. I'm calling out the faith leaders. And I'm a Christian, yes, but I'm calling out the interfaith community. It is a place and space that is missing. Do not think that everybody's the same in church because you're mad at somebody in church. No. It is an institution that carried the movement. It's an institution that has kept us all these years. And your personal gripe is got to be diminished when it comes to advancing an entire people's agenda. Dedication to the diaspora. This was hard for me because I grew up in Camden, New Jersey. I didn't realize how much connection we have. The sister said there's 80% Black people in her town in Puerto Rico. It probably looks like my cousins back at home. And I'm saying your dedication to the diaspora has to come from you seeing Blackness as transcending waters. That's the beauty of the diaspora. And this is my last one and I'm done. Your obligation to the Black carpet moment. What's the Black carpet moment? You know what the red carpet is when a movie comes out and they have a red carpet moment when you get dressed up and everybody is coming in to see the premiere. I'm here to talk about the Black carpet. The Black carpet moment is when you look past the DEI officer in your space. The Black carpet moment is way bigger than just a phenomenon called DEI that some people started investing in because George Floyd was killed on TV. The Black carpet is setting a pathway that whenever you take a step, you always stop to turn around and begin to start laying down the Black carpet. That Black carpet is for my 9-year-old son. If you have that picture that I asked them to send, please post this little boy. I want you to show you, that's the Black carpet right there. That's the Black carpet. I want you to know that he's 9 years old. And he got swag. The boy got LeBron's on a horse, baby. He's different. But the Black carpet means that when he turns 18, there's going to be enough MPH programs and public health leaders preparing for him to come to your university. That means when he turns 25, every corporate leader, nonprofit leader already knows that when there is someone coming behind that brother or that sister, there's more that's going to come behind them. The Black carpet has to be rolled out. And it's not instead of, but it's in addition to. Because trust me, if he comes up, I promise you, everyone around him will come up, because I'm training this boy to love everybody, but to also love his beautiful chocolate self. I don't know who I'm talking to, but I'm saying it's time to advance the black carpet. It's time to get out the basement. Turn to the next picture. Let me close with this. There should be one more picture you receive. I want you to see, I want you to look at this right here. Now, first of all, you know my kid got on sunglasses. I don't even know how that happened. But I want you to look at this picture very quickly. And I want you to see the joy of these two. His brother is Elijah, his Jack and Jill brother. That's not my son, it's my friend's son. And these two were at a pool party. Now, I don't know where he got this whole I'm about to sit in the sun thing. I don't know where he got that from. But I want you to know this. When I look at these two, that's health equity achieved for me. You want to know why? He's not thinking about his color in this picture. He has no idea that he's a threat to anybody in this picture. Every resource is made available to him in this picture. He has zero stress in this moment because this is Black boy joy right here, unprecedented and beautiful. And if I set the black carpet up right, then these two are going to be the next presidents of the United States. They're going to be the next university presidents. They're going to be the next researchers. So get out of the basement and pull out the black carpet.
Stay standing, stay standing, stay standing, stay standing. And start our church dance. You know the beat we have? Oh, yeah. 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 All right. While we doing that, we clapping. We want our response panel to come onto the stage. Make your way to the stage, response panel. Because we're going to go right into the response for this, because that was powerful. My goodness, that was powerful. Is that how you start off a conference or what? Oh my goodness. Oh my goodness. That is how you start off a conference, y'all. All right. We're going to go right into our response panel. That was something else. Thank you, Reverend Bradley. We had Dr. Bob, we had Reverend Bradley. I mean, my goodness. Let's see if we can respond to this. This is the response panel. And on the stage with us to respond to what we just heard, we've got some distinguished guests. We are so glad they have decided to join us and to be a part of this response to what we just heard. I mean, my. You have water? You got water. We got water. We got water for everybody up there. All right. First, on our response panel, on my far left is Dr. Idania Rodriguez Ayuso. She is the Director of Health Promotion and the Division Director of the Puerto Rican Department of Health. So we got somebody from right here on the islands helping us in our response, because as we heard, as we talked about the diaspora, we're in Puerto Rico. Puerto Rico is Black too. Somebody asked me, why y'all having the state of Black health in Puerto Rico? I say, they got Black people in Puerto Rico. And so we got Dr. Rodriguez Ayuso that is going to be joining us in our response panel. We have my brother Daniel Dawes, and he is literally my brother. I mean, we go back a while. He's been with us since we've been doing the State of Black Health and speaking and participating and helping us. He's a healthcare public health leader. He is the executive director at the Institute of Global Public Health and the founding dean of the School of Global Public Health at Meharry Medical College. He is the author of that book that Shavon was talking about, The Political Determinants of Health, as Daniel Dawes right here to my left. To his left is Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation. We are so glad that you are here, Dr. Besser, and participating in this discussion. To his left is Dr. Ayla Stanford, National Leader in Health Equity and Healthcare Policy Advisor. She recently served as a Regional Director of the U.S. Department of Health and Human Services of the Mid-Atlantic, appointed by President Joe Biden. Thank you, Dr. Stanford. So let's get into our response to the State of Black Health Address. All right. Is this working? A little blocked by this podium here. I don't think there's nothing I can do about that. We're just going to be blocked by the podium. Are you guys ready to talk about the State of Black Health?
We're ready.
You're ready? Let's talk about the State of Black Health then. Who wants to? Daniel, let's start with you, since you're ready. Since you're ready. Now, what can we as organizations or individuals do to address the disparities that we've talked about that exist at the intersection of health, social justice, and economic empowerment? What can we do to address that?
Ooh, there's a lot we can do. But first, I just want to take a point of privilege to thank you for leading from the front lines, not the sidelines on these issues. And for all of you who have been doing that to make sure we can create a more healthy, equitable, and inclusive society. So if we want to go beyond nibbling around the edges of the problem, one of the things that we need to do is change our mindset. And what do I mean by that? Over the last year, as I've traversed the country, and as Shavon mentioned with the different regions of our country, one pattern seems to be coming through, and it's this cynicism and apathy that health equity is beyond our reach. In fact, not only have I heard this from health equity minded leaders, but I've also heard it from scholars who've even published this in peer-reviewed journals. That's extremely frightening to me. And it's frightening because Michelle Obama, after the Dobbs case, and actually after the affirmative action case, made this similar statement that we need to be careful how we allow pessimism to push us further into helplessness. So what can we do? I think Dr. Martin Luther King Jr. told us what we need to do 60 years ago, in fact, in 1963, when he says we need to go for the root cause of these inequities, whether health-related or otherwise. And he even went further to say what we really need to be doing is working diligently and collectively to address the vestiges of the old order. Okay, a lot of what we heard from Shavon and Dr. Ross earlier today. So in moving then to thinking about how we address the root causes, Shavon also mentioned we need to get more involved in advocacy. We need to understand legislation. And that again reminded me of what Dr. King was confronted with by many civil rights leaders when folks said, Dr. King, wouldn't it just be a better use of our time to focus on education and religion? Let's just tug at the heartstrings. Let's really push people to understand these things. And he thought about it and he said, you know what? You're half right. You're correct. We do need to address those things. And we also need to become politically involved. We have to understand the levers that have been pushed and pulled over time to either hinder or advance this agenda. So as I think about, what has held us back and what we can do as organizations and as individuals to address the problem of health disparities and inequities, we really do need to overcome this scarcity mindset that many of us have had. I've seen it in many of our HBCUs. I've seen it in different organizations. We also need to overcome this penchant for underinvestment in the health equity movement. And then I also think we need to understand from a policy standpoint, right, how the few health equity achievements that we have achieved, whether it is the Patient Protection and Affordable Care Act or other more recent policies, the reason we've been able to do it is because our leaders understood that the ones that have succeeded were tied to the commercial interest and a government investment value. That's how we were able to successfully move that agenda forward. So it boils down to me with what Shavon mentioned, with Professor Little Kim, right? Talking about power and money and respect. I break it down in terms for the political determinants of health, in terms of the systematic process of structuring relationships, distributing resources, and administering power, understanding how they have operated at all levels and throughout our history, right? Whether at the local, the state, or the federal level. It's so key that we understand this and we measure this. I could go on, but I will stop there. I think those are some of the things that we need to do.
Thank you. Thank you. And I think I'm going to stand up from here because I can't see folks over there when I'm sitting there at this podium. Dr. Besser, you want to take that same question? How do we build a sustainable community? What do we as organizations or individuals, how do we address the disparities that exist at the intersection of health, social justice, and economic empowerment?
Thank you for that question. And I'm still reflecting and just totally blown away by the speakers this morning. When I was thinking about this question coming here, my whole career has been in public health. And in public health, there's a lot of focus on disparities, looking for differences in health outcome by race, by gender, by geography, by income, and then focusing programs to address why someone's sick, diagnosing it sooner. And I think what your question points to me is something the speakers lifted up, is that we can't have the focus be disparities. The speakers lifted it up. Professor Ibram Kendi lifts it up. Whenever you see a disparity, you have to say, what is the inequity that's driving that? Why is there a difference in opportunity for health by race? And then you have to go after that. And to us, that points to the importance of policy, what Professor Dawes was just lifting up. Because if you don't change the policy, you're going to be taking care of sick people forever. And you may see some difference in outcome, but you will not see a difference in equity. And equity is what it has to be about. It has to be about that opportunity for health and ensuring that everyone has a fair and just opportunity, because it's not there. In public health for too long has been all about putting in programs to diagnose something and treat it. It has not been upstream addressing the root cause of why we see these differences.
Thank you. Thank you. Dr. Stanford, you want that same question? What can we do as organizations or individuals to address the disparities that exist at this intersection of health, social justice, and economic empowerment?
Thank you very much. I'm going to use myself as an example. By training, I'm a pediatric surgeon, but I'm also a physician scientist. So I spent lots of times doing basic science, clinical research, and all of that. But during COVID, and I'm from Philly, when people called and said, Ayla, I think I have COVID and I can't get a test, and every place they went, they got turned away, and they were Black and educated with insurance, but they were turned away for a myriad of reasons, because they weren't in a car, because they weren't old enough, because they didn't have a prescription from their doctor, because their doctor wasn't on staff, because they came by foot and they should have been in a car. And I said, I'm going to take the infrastructure of my practice and I'm going to go to the people, which is what you do in a public health crisis, or when you're trying to eradicate health disparities, you have to go to where they are physically and also meet them where they are, Shavon, to your point. And so that's what we did. And we subsequently took care of 100,000 people as a grassroots organization. And when it comes to money, power, and respect, I didn't have a lot of money, but ultimately the community gave when they saw that they could trust us and that they didn't ask us to come, but we went to their churches, to their parking lots, to their schools, to their labor unions, to their mosques, wherever they were, to say, we are here, and we advocated for. And all of the research that I had done in my training and being my own business owner, I was able to, I didn't have to ask for permission. I wasn't worried about my tenure because I didn't have to answer to anyone. And when people started coming to these communities with the lowest life expectancy in Philadelphia to take vaccine, I was able to say no. Because when you go back to your community where the positivity rate is lower and you shelter in place and you work from home, but the folks here are forward facing and they're exposed and they're transmitting the disease, you're not helping the public health crisis. I caught a lot of flack for that. I got a lot of hate mail for that I was being discriminatory. And I said no, because in a public health crisis, you go to those who are most in need, who are most vulnerable, who need a safety net. And if that happens to be Black and brown people, that's where you'll find me. And what we need to do, I did that at grassroots, but then I disinfected and I sat on the Board of Health. And then after that, I was recognized by President Biden to help push some of that legislation as a regional director in Health and Human Services. So I say that to say we need to be at all levels. And the reason why things work so well is because I could touch the people and they could tell me what they needed, but I was in a position of power to translate that immediately to the health commissioner and subsequently to the state. And that was why Philadelphia vaccinated more Black Americans by percentage than any other city in the United States. And that was largely from our work. But again, it was because the people trusted us, because we went to them. They told us what we needed, what they needed, and we were able to use all the research that the people in this room have done for years, but never actually get put into action. The work has been done. It just needs to be funded. It needs to be sustainable. It needs to not be a one-off when the funding cycle is over. And we need to show the evidence, as Dr. Ross said, so it can continue to be funded with our outcomes.
Thank you. Thank you. Dr. Rodriguez, Ayugaso, do you want to respond to that same question? What can we do as organizations or individuals?
Good morning to all and welcome to Puerto Rico, my beautiful island. First of all, as I represent the Department of Health, we have to say that we have limited resources. Therefore, we value the collaborations that we have with other entities. Therefore, to understand the reach and impact of community organizations dealing with these issues that we have spoken, help us join forces, work together, and build stronger connections with them. For instance, health organizations can team up with local communities to offer valuable resources, such as free health screening, workshops on managing finances, and job fairs. Moreover, organizations and individuals can team up to push for fair policies, boost knowledge and understanding, back business owned by minorities, and put resources into programs that offer access to healthcare, education, and economic opportunities in communities that have been left behind. It's about working together to make a positive change.
Absolutely. Absolutely. Thank you. Thank you. You know, Dr. Bradley, she had talked about, apolitical being apolitical and being always political because, trust me, things are always political. And anyone can take this question here. How do we build a sustainable community infrastructure, given the polarization of governmental entities in charge of making policies that govern health and social welfare? How are we going to do this with those structures? Example, how Florida, they've got this war on woke culture. How do we address this? And anyone can take it there.
I think you have to show the politicians and the legislators that it's a win-win, right? They want to be reelected and they want to be in a position of power. So how do you present something to them that benefits the people, that also benefits what they want to do? And I'm just being honest because I just left this space, right? The other part is recognizing that the federal government gives a lot of money. And that's the one thing I recognize working with HHS. But it's once it gets to your state level and the local level that things get messed up. And the federal government they don't have the bandwidth or the accountability to see what happens to the money once they send it out, right? And so it ends up being, how does the health department look good? Like, we know we're about to get a monovalent vaccine come out this month, right? The Philadelphia Health Department wants people to take it. They know that I'm a trusted messenger. So how do we collectively work together so that we don't have positivity going up, severity of disease, hospitalization, and death? And it looks like they're doing their job. And then how do I also serve the community by making sure people are getting what they need? But how do I keep my medical practice sustainable? That value I bring as a trusted messenger, it's not for free. Okay. So, and I think more our community-based organizations have to, let me back up. We have to make sure people recognize the value that we bring to these leaders. So they want to get something passed. They can't get it passed without our input, right? And I think that the more and more we can put a dollar sign on that, it becomes a win-win for the community, a win for the politician, and collectively we're all getting to what we need and want.
I'll just add, from an experience that I had when I was in Georgia, having spoken with Ambassador Andrew Young, who is a civil rights icon, we're talking about what did you all do during the civil rights movement to push these racist politicians and these business leaders who, quite frankly, had innate racism as well? How did you push them to support that movement? And he says, Daniel, it's because we showed them that racism is expensive, right? Racism is expensive. And he said, what we need to do is to constantly remind folks, those in the majority, those in power, that there are economic consequences to their decisions, right? Because what impacts the minority will impact the majority. It is a lesson that I think David Jones, who's now deceased, he was an incredible scholar from Boston University, and he did a landmark study looking at the Delta in Mississippi. And he found that those in that region were struggling with getting policies passed at the state level, right? Their leaders were not effective in getting legislation passed. And as a result, they were not bringing the resources into the community that they need to reach their optimal or full health potential. So in looking at that study in Georgia, what we did was and this is looking at it from a practical standpoint, we mapped out all of the governmental districts, the representatives and the senators. We looked at their districts, and we looked at the data, the public health data, to understand what were the top 5 chronic diseases, both physical as well as mental, that their constituents were dealing with. And then we broke it down by race or ethnicity, and we went the extra step to do an economic analysis to understand what is the cost burden owing to our failure as a state to address inequities. And Georgia loves to be the #1 state for doing business. So again, we pulled that into the equation, and it was amazing. Senators for whom the moral argument wouldn't resonate, all of a sudden when we made that argument, we saw piecemeal wins at the state level with investments for maternal mortality, right? For opioid addiction. We saw also others for diabetes and infant mortality issues and so forth. So that was a huge win and a lesson learned in how to push the appropriate levers, knowing who is in your audience, right? Knowing who wields the power. How do you get them on your side? How do you get them to have an ownership interest in your community? That worked for us, at least in that state. And I will just say, since we're here, well, we're not in Florida, but I know you talked about Florida. St. Petersburg, Florida. And I know there are a few St. Petersburg folks who consistently come to the conference. That group of leaders, African-American leaders, recognized that they needed to create a Black Health Equity Alliance. And they needed to create an alliance that had diverse racial and ethnic folks, people from the business community, anchor organizations, governmental folks. So their council members, their mayor, vice mayor, representatives, and senators. And they brought all of these individuals together to start mapping out the inequities within their community. They highlighted the history. They documented where lynchings had taken place, right? And a study that Shavon mentioned out of Texas, looking at those areas with the highest concentrations of slavery, they did the same thing in St. Petersburg, and they found a similar result there. And so they went about collectively working to address those political determinants of health inequities first, and then developing an action plan to address both the economic, because politics and economics are two sides of the same coin, coming up with a strategy to not only repeal existing laws, but to also amend laws that could be amendable, and also create new laws that would positively benefit the community. That to me is a case study worth looking at, because they became the first city in Florida to actually get a policy declaring racism a public health threat. Think about that in Florida, right?
Yeah.
So that's remarkable.
Okay, thank you, thank you. Dr. Besser, for a decade, our WJF has been working to build a culture of health in America. What have you learned, and how have you changed your focus to use what you've learned?
It has been a decade. I've been at the foundation almost 7 years, and it preceded my arrival. And a culture of health is all about recognizing what some of the speakers said this morning, that health is about more than access to healthcare. It's about what takes place in communities. And so for a decade, we have focused on that, the conditions in which we live and work, where our kids go to school and play, and what's available. But the focus of a culture of health was very individualistic. And it was about helping people make the right decision around their health. Eat right, exercise, get vaccinated. All of the things that public health has long lists of what people should be doing, without the focus being around who has the opportunity to do those things and who doesn't, and why. And so over the past, since we launched the culture of health, there's been an evolution and much more of a focus around health equity and talking about systems and structures that either provide privilege or create barriers. And I would say that it was in 2020 with the COVID pandemic and the murder of George Floyd that we looked hard at our work and looked to see in America where are the biggest barriers. And the biggest barriers are from structural racism. I don't need to tell this conference, but for our work, it allowed us to shift and pivot so that, yes, we are about a culture of health, and yes, we are about health equity, but we are laser focused on what we can do as an institution to dismantle structural racism. If we truly believe in what John Powell lifts up, the concept of targeted universalism, we believe everyone should lead their healthiest life and have that opportunity. So you have to go after the thorniest problem, and in America, that's racism. And so you will see hopefully you have seen an evolution around our funding and the organizations we're funding. Moving away from some funding that we funded for a long time that has not shown it's been effective. More of our funding around general operating support, because we recognize that the organizations that we fund, we're closer to community, know what needs to be done much better than we do as a large philanthropy. And so that's all an evolution that's been underway. And to me, it's really, really exciting. We are using our voice more, and will continue to. But it's also recognizing when we should use our voice and when we should create space for the voices of others. And so there's always that question whenever an issue comes up. Should we be speaking? Should we create space for others? How can we do that to help move an issue forward?
And that's really important on an issue such as structural racism. You know, the messenger is very important. And as Dr. Bradley said, you know, the voice of the foundation is good, but as you said, what organizations are we working with that would have a better voice that would resonate with the community? It's like we had that example earlier when we were hearing Spanish and nobody was understanding. So who can we fund that can understand and be an interpreter for us? What are some other strategies for addressing systemic and structural racism? Anyone want to challenge that? Because I know that there's racism even here. I mean, we're in Puerto Rico and there's racism that exists.
I do think that the first thing is to recognize that it happens. Many people in Puerto Rico think that there is no racism here. And when you see the news in which there are situations with people that they took out their boys because they were Black or they were not from Puerto Rico and they have a language barrier and they were Black, then you start seeing that there is racism.
Right.
Therefore, I do believe in the organizations that are beginning to talk about it openly, that are doing studies about it, and that are working towards the recognition of this problem here in Puerto Rico, because if we don't recognize it, we cannot work towards eradicating it.
Yeah, that's key. Identifying and calling it out that it exists, that it's real. Any other strategies that we have?
I call them teachable moments. And as a physician, and they're all my colleagues. So, you know, you don't want to say what you did was racist, but I'm going to give you two very quick examples. College student, 22 years old, has an abscess on her labia, goes to the ER. They give her some pain medicine to go to Lancet. She says, "It hurts. Can you stop?" Rather than stopping, they brought in more nurses, held her arms down and her legs down while they lanced to drain this boil or this abscess. She subsequently bled so much that, and they were calling for a doctor. No one came to see her until later, that she needed a blood transfusion for an abscess. And this wasn't a long time ago. This was like 2 months ago. Now, I know all the doctors there and so forth. And I text and said, "I just want to let you know before this gets to, you know, ethics, what happened." And the first thing he said, "This had nothing to do with race." And I said, "She's a 22-year-old Black woman, somewhat obese, college student, just came to the ER because she was having pain in that area. And her mom was working, so her grandmother came and she didn't know. She's 80-something years old. Honey, you got to let the doctors do what they need to do." I said to my colleague, if that were your daughter or your wife, would you want that to have happened to them? You know, and that not only did she have this traumatic experience, but that she bled while her mother was changing chucks all night till someone could come down and check on her in the emergency department, so much so that her hemoglobin was 7 and she needed a blood transfusion. So rather than say what I really, really feel, right, that could make me cry as I looked at this young girl, is to say it's an opportunity for us to really see what was it that made us treat this young girl different than you might have treated your own daughter. And I think that for me, it's been storytelling, because I don't want to push away potential allies and recognize that some people don't know. My attending used to say, your eyes only see what your mind suspects. So if you can't conceive it, if you don't recognize that bias exists and that you may be the one perpetrating it, you'll never change it. But with real life examples, I think that's helping. And I call them teachable moments.
Teachable moments. Thank you. You know, we also talked about economic empowerment. We're talking about communities that have been intentionally marginalized. How do we sustain economic empowerment when organizations, groups, governments are intentionally marginalizing communities. Don't all jump on it at the same time, share. All right. No one wants to challenge that?
All right, let me, I'm going to start with another study. Many of you may have read Professor Chetty and his colleagues' study looking at Black and white children in families who are in the upper quintile of income. And any of you remember that study that showed that Black children, after a 20-year period, were found to have fewer opportunities and, of course, more obstacles placed on them throughout the life course, which made it easier for them to slip from that upper quintile to the lower quintile, versus white children that were 5 times more likely to stay in the upper quintile than move into the lower quintile. Anybody remember seeing that? Yeah, a few did. And that study struck me because the researchers concluded that even when resources are similar, Black children experience fewer opportunities and, of course, more obstacles in their pursuit to reaching their full health potential. And so it does boil down to what you just mentioned, right, about structural racism. And as I think about what I heard, Shavon mention, as she discussed the affirmative action case, and we think about the revelations from this case and other case laws, we think about the wider lessons from this. One of the things that I've been struck is how the courts have been on this warpath, changing the goalpost, if you will, when it comes to measuring structural and systemic racism. So they will prematurely eliminate policies that are making some traction without the evidence. But yet, when we are trying to advance more egalitarian policies, more equity-focused policies, you have to bring that evidence. You have to demonstrate that you can measure this, that the intervention is working, right? It's a fascinating thing for me. So for us, when I think about economic empowerment at Meharry Medical College with the School of Global Public Health that we're creating, this is an intentional creation to address exactly what you just asked. How do we empower the Black community and Brown community? How can we create Black and Brown zones across our country and the world, right? Many of you have heard of the blue zones with longevity. How do we do that and help our learners navigate those political processes and the societal structures that have impaired our ability as a community to advance the cause? So those are questions that we are going to be tackling at the new school. And I'm looking forward to working with all of you who are interested in harnessing the power of collaboration to do that.
Thank you. Yep.
So at the foundation, we've landed on a number of generational goals, and one of them is around economic inclusion for family well-being, because it's clear without economic inclusion there is no health equity. In our work, there are a few areas that we are focusing on. One has to do with tax policy. People say, well, why is the health philanthropy focused on tax policy? Well, if you look at what happened during COVID, where the federal government stepped up and put money directly into people's pockets, you had the child tax credit that was advanced to people. You have seen increased unemployment benefits. All kinds of economic supports were given. We saw a 30 to 40% decline in hunger and child poverty. And so as the wealthiest nation on earth, we know that you can eliminate poverty. You can do it through economic measures. But when the Congress had the opportunity to extend some of those programs, extend SNAP benefits and WIC expansion, extend the coverage for Medicaid, they said, no, we're not going to do that. So building the will to see those policies move forward is one aspect. Another area that we're working in that I'm really excited about is using some of our capital as a foundation. So investing, just storing some of our money in financial institutions in Black communities, provides resources that can then be loaned out for small business owners to create sustained growth in those communities. And that's something using our balance sheet that is new to us, but we're really excited about. We also have a really exciting program around program-related investments where we are providing loan guarantees to drive capital into Black communities. So we assume the risk, and it allows private capital to come in. One of the funds we're invested in is the Black Star Stability Distressed Asset Fund, and this is providing resources to people who were victims of shady loans. These targeted mortgages. They're in homes, but they're at risk of losing them. Coming to this fund, it allows people to refinance, maintain the equity in the investment, and go forward. There are a number of ways that we're coming at this, but it's really important to make the case of the connection between economics and health. I think there's nothing that would improve people's health more than eliminating poverty.
Absolutely, absolutely. And again, that's one of the reasons why we are here, to talk about that intersection. You know, as we're looking ahead, as we're going down the road, what do you see as promising practices that could help us overcome the current state of Black health that we're in? Getting out of the basement. What do you see as some promising practices that we could take?
I think something promising, as traumatic as COVID was, is it lifted the veil on so many things. And so you don't have to go back to Tuskegee or Henrietta Lack or Holmesburg Prison to look at things that were unjustly done to Black Americans. You can look right 2020, 2021, 2022 in COVID. And I think what we cannot allow is to go back to the way it was. And so again, opportunity I have using a platform, my platform and our center's platform, is to talk about those things and to say, you know, to the academic institutions and to the health department, local, state, and federal and community-based, what did we learn and what are we not going to repeat? What worked really well during COVID in the height of the emergency that now we pulled away, how can we restore that on a sort of normative level that people can continue to benefit from? And to your empowerment question, the obvious answer is we have to own some stuff, right? So you can decide who you're going to employ. And for some of us that may not be entrepreneurs that we can hire and build up communities, education is a huge way out for a lot of impoverished children. Huge. And each one of us deciding that we were going to mentor and or support one child in their education, that they can then attain a higher professional level and then support their community and support their family, goes a really, really long way on a small individual level.
In the case of Puerto Rico, the problem that we have is that most of our statistics are Latinos. There are no divisions by race in most of the statistics. And the data is what drive policies, is what drive things to be done. Therefore, I do think that with the groups that are working towards putting their information about Black people, it will be helpful. That will create mentorship programs. It will create new business. It will help people to identify with other that looks like me, you know, having this reference, these people. And then I do think that people will be able to increase their health, their education, and the things that they do.
It was like, Rich, you go first.
Can you repeat that question?
Yeah, as we look ahead, what do you see as promising practices that could help us overcome the current state of Black health?
I see a number of things. I see this meeting as a promising practice. This group coming together in a room full of people who are committed to health equity, racial equity. Yeah, I was really struck by the comments this morning about what it means to be an ally, an allyship, and the importance for white leaders to not see addressing racism as a Black problem to be solved.
Right.
And the number of tables that I'm invited to, where it's not part of the conversation, where I have the opportunity as a white leader to lift it up and not have the conversation be about race, but about racism. And it's a different conversation when you talk about racism than when you talk about race. It shifts it from a conversation around, well, why are Black people in Black communities not practicing healthy behaviors? You know, why are to what are the systems and structures that are in place that are not allowing people to lead their healthiest lives? Right. And in that shift in conversation, the call for data to be able to measure racism instead of just race, those measures, I think, give me some hope in terms of addressing this. And the fact that over 200 public health departments lifted up racism as a major health issue, that's promising. We now need to turn that into action. What does that mean, and what is done differently?
That's true. What does it mean? How do we address it?
So we've heard today that the current state of Black health is tied to the current state of funding opportunities for our community. And I think Shavon made that loud and clear. We heard Dr. Besser mention that in terms of poverty. I think we need to do a better job really looking and tracking funding opportunities. You and I have talked about this from the CDC perspective. I think it's resonating, that persistence is resonating. That's a promising practice, right? And it really ties to advocacy. I can't emphasize that enough. As Shavon mentioned, it's not about partisanship. It's about political advocacy, getting involved, making sure that we're consistent. We're not complacent because we've made a win, if you will, and believing that the rest is going to work itself out. So I do think if we are mindful of that and focused, we will continue to see the change. And I just want to add that for me, I started out with many folks being apathetic, being cynical, right? And of course, I know Ken Burns, the prominent documentarian, has mentioned we are in this fourth great crisis in U.S. history. But as health equity leaders, I hope you'll think about the period that we are in. We are in the fourth period of an awakening around health equity. This is remarkable. The first one happened under President Lincoln 100 years later, 2 years into the civil rights movement. We had leaders like yourselves focusing on overt forms of discrimination. The third around the disparities, if you will, in minority health and so forth. And now we have a period where folks are actually talking about the R word, racism, talking about upstream determinants, talking about how we can center this agenda. It's an incredible time to be alive in our country today, and it's a time for us to leverage to move the needle forward. So thanks again.
Thank you. Thank you. Yeah.
I was quickly, again, to the evidence. February 2023, most of you saw about Black women, infant mortality, and their mortality around childbirth, and saw that a poor white woman is 2 times more likely to survive in her child than an educated, rich Black woman. And if that is not evidence enough over the hundreds of thousands of people that were studied, we have to use the evidence, not argumentative, but to say, look at this data. My goodness, it's fair. What are we going to do about it? We've got to put more funding. Or when we looked at the data that a Black child and a white child, healthy, same operation, but the Black child is more likely to be readmitted, to have complications, and to die from something as simple as an appendectomy in the United States of America. And I cannot, as a pediatric surgeon, that be acceptable. So then it's the conversations with my colleagues, the legislator in the health department, to say everything else was controlled for, every variable. The only thing left was race. And I think when you get to that point, we are all a product of the experiences that we felt and where we've lived. It's not your fault. You didn't create it. I was born Black. You were born white. You were born Latina. Certain advantages and privileges you had, certain ones I didn't. You were building generational wealth. My family was doing cheap labor so you could get to that generational wealth. It's not your fault, but you benefited from it. So now that we're all on the same page, how do we collectively move forward? Because in 2050, over half the US population will be people of color, and it costs way much more money to do reactionary medicine than it does to be preventative. So how do we keep our taxpayer dollars in our pocket without having to pay for all these people of color with these chronic health conditions that are going to use it and use up all our critical care dollars if we just invested more in controlling their diabetes and had early detection for their cancer, and that they weren't having strokes and heart attacks and being non-productive members of society? This benefits us all. So there's no more shame, blame. It's all about allyship. It's all about all of this happened before we got here. But now that we are here and we can do something about it, do you want to do that with me? Can we do that together? Let's get to this better, because when we are healthy, one person is healthy, everyone is healthier for it.
Yeah, absolutely, absolutely. All right, we're about out of time. Any final remarks that anyone wants to make before we are forced off the stage so that they can continue the program? Any final comments, final remarks? All right. Let's give all of our speakers a round of applause. Thank you so much. We're going to leave the stage now, and we're going to turn it back over to Mark Lawrence. Thank you again. Sir.
Big thank you and round of applause for all of our panelists. I know you've been sitting a long time and your butt is probably numb. So stand up, everybody stand up and stretch the legs out a little bit while we introduce our next speaker. You know, give your butt a wiggle. Don't be twerking out there, but wiggle. Just get some circulation back in your bones and your muscles. And we'll introduce the next speaker while you're doing that, pulling yourselves together. Let me say this: gun violence has reached an unprecedented level in the United States. And here to talk about how we can end gun violence epidemic through a public health approach is the managing director for the Center for Gun Violence Research and Education at Kaiser Permanente. Ladies and gentlemen, please welcome to the stage Dr. Angelina Ruffin.
Right. Yeah, no, it's okay. I mean, I know everybody needs a little break.
All right, everybody should be,
Let's get started.
everyone should be well loose right now. Go ahead and have your seats, and we're gonna get moving right along in our agenda. Hello, y'all in the back.
Do it old school.
Don't make me come back there.
All right, thank you. All right, I'm gonna get started. So thank you for that warm introduction. Thank you. Okay, I think I want to start with a question. How many of you over this past weekend heard of shootings in your community? I got a show of hands. How many? Can you count them on one hand? I'm from Philly, so there were 4. And there were 4, but there were 2 in particular that really stuck home for me. And I'm just going to show a clip of one of the news reports of the shooting. Can you run that for me, please?
The Darby superintendent of schools sent out a letter to parents informing 16-year-old and said was a student up and running. I think both families with a state in this area, each 5 and she didn't that's about that time the mention of face. I think that the problem if you and is telling the both homicides remain under investigation.
So thank you. So what do we hear there? So there was a 12-year-old found in a dumpster from a gunshot wound in the head on Thursday night. By Saturday, the 16-year-old who was thought to be the suspect was also murdered. Okay. What the news report didn't get into is that they identified the 16-year-old through social media. So online, there was chats about who did what. And then someone went and murdered them out of retaliation. So now we have 2 children that are killed, 2 families mourning, 2 communities mourning, 2 schools mourning. I mean, these neighborhoods are constantly dealing with this level of trauma, right? These are my 2 boys who I'm raising in Philadelphia. My oldest son, Chase, just turned 13. So, as a mom raising 2 Black sons in a city like Philadelphia, I hesitate every day to think about, oh, can I let him go play at that neighborhood basketball court? Even though we live in an upper middle class family, this is just our reality as Black people in America, where headlines like this, we're constantly inundated with, right? Someone in a bulletproof vest shoots up a street. This happened literally across the street from my dad's office and 2 blocks down from my big mama's home, my grandma's home, okay? Cookout, somebody gets shot. Domestic violence shootings, kids being hit by stray bullets. You're taking your kids out for 4th of July fireworks. Gunshots may ring out. I mean, what is clear is that community violence is centralized, okay? It's in particular neighborhoods, and it's by design. It's not an accident. It's cyclical, and it's socially networked. So when you think about gun violence, in reality, it is concentrated, again, certain cities that have been under-resourced, racially segregated, and it happens all the time. But what's the dominant narrative? The dominant narrative is that when you think about gun violence, is that it's a law enforcement issue, right? It's addressed by law enforcement, police, right? That it predominantly affects white people through mass shootings. But our lived experience and the data suggest otherwise. We had almost 50,000 gun homicides and suicides in the US in 2021. It's dramatically increased through the pandemic. And for our Black kids under 18, it increased 50% in those years in 2019 to 2021.
54% of the gun deaths were suicides. 43% are homicides. And that small sliver there, the 3%, collectively includes the mass shootings, accidental shootings, and shootings by police. So the mass shooting narrative that it's not a leading cause of death. And who do you think is bearing the brunt of this? Sure, we know it's no surprise. The leading cause of death for Black men and boys is gun violence. The second leading cause of death for Latino men and boys is gun violence. It is a public health crisis because it is the leading cause of death. We are dying, and this has been happening for decades. And like mass incarceration of Black men, society's kind of silent on it, right? We don't hear this. But this is alarming, alarming. We already said that the young Black Americans experience the highest rate of gun homicides than any other demographic. Black Americans are 10 times more likely than white Americans to die by gun homicide. In 2020, there were 12,000 plus Black Americans killed with a gun compared to 7,000 white Americans. And even though we make up just 12.5% of the nation's population, we are 61% of the victims. Black Americans are 3 times more likely to be shot, fatally shot by police than anyone else. Dismal outlook for Latino Americans too. 60% of their gun deaths are gun homicides. And even though young Latinos represent just 4% of the population, they are 8% of all gun violence, gun homicides. Black women, other women of color, we don't get a break. We get it too. We are twice as likely than white women to be fatally shot by an intimate partner. Guns are in more than half of all the homicides of women, and it's disproportionately impacting us. Native women and Alaskan women, they are 3-4 times more likely than their white counterparts to be killed by a gun. And our children and our teens are 10 times more likely to be hospitalized for a firearm injury than their white counterparts. The previous panel talked about structural racism and structural violence. All of these interconnected layers, these policies, that system that just have been put in place and continue to just put our communities at this vulnerable position where violence is going to continue to happen because there's no economic opportunity, there's mass incarceration, there's policies, housing segregation policies, all of that that impacts and intersects to just create this cyclical trauma, gun violence that keeps happening in our communities. So depending on a narrative will lead you to what are solutions. Again, if the narrative is about mass shootings, the solutions are law enforcement. If the narrative is that it's a public health issue, it's a leading cause of death for us, then the solutions will look a little different. And that's what we need to be talking about. The public health model says, all right, let's define the problem. We did. It's the leading cause of death. Next, identify the risk and protective factors, which we also know. Then we develop solutions, we test them, we build that evidence, and then we scale and adopt. That's not what's happening on a large scale. We know the risk factors. Our neighborhoods are deteriorating, they're underinvested, there's income inequality in these communities. And then we also know the protective side, right? Mentoring programs, after-school programs, recreational clubs, social mobility, all of those things are protective. But to have an effect, we have to intervene at all of those layers of the ecological model. At the individual level, we want our people to receive trauma-informed care, right? Case management services. At the interpersonal level, make sure that our communities are supported, have the resources that they need, right? Of course, there's a part of public policy to play, absolutely, but that's not the focus of my talk today. Because we know what works. I'm sure all of you can rattle off some community organizations that are addressing gun violence in your community, but they're not widespread enough. They're not talked about enough. They're not considered part of the solutions. Us as Black people are often considered the culprits, right? We're the culprits. We're creating this in some way. And the conversation needs to shift to say, we have solutions. We know what works in our communities. We need to build a community violence intervention ecosystem that really is community driven, focuses on those who are most at risk, which is our Black and brown brothers and sisters, utilizing multiple strategies that intervene at the different layers of the ecological model. Street intervention outreach, like Cure Violence, Advanced Peace, those programs, they use violence interrupters. So they employ community members who know what's happening on the street to be trusted messengers to intervene when there's a incident or if there's knowledge of a beef that's happening in the community. Peace fellowships, hospital-based violence interventions. When someone gets shot, they go to the ER. That is an opportunity to wrap those people in services, case management. And there's data that supports that this works, okay? The core components, again, we want to focus on those who are at most risk. Leverage our credible messenger, hire those with lived experience, those from the community to be a part of the solution. Again, provide that wraparound care. We want job readiness. We want economic opportunity. We want all of that to have an impact and provide them with stipends, pay them to try to find a different way of life. And there's community organizations and programs that are doing this and are getting success, but they're not talked about. And then monitor the progress and transform. This has, again, there's some programs that have had some evidence behind it. And in Oakland, they had a 50% reduction in their shootings. In New York, same thing, 40% reduction in shootings and fatalities. I mean, that is huge. And there's many other programs like that in our communities that just don't have the infrastructure to do the research, to build that, to create that evidence and knowledge. So what are the challenges to getting more community violence intervention programs? Money, right? Since 1996 to about 2020, there was no funding for gun violence research. Okay, just in 2020, there was a $25 million investment, and since then, it's probably been about $63 million. But compare that to the research, $155 million for motor vehicle safety research, which is not a leading cause of death. So what has happened? Philanthropy has filled in the gap. Robert Wood Johnson, Arnold Ventures, and others have put up some funds to also, again, try to address this. But the federal funding that we see here in the past couple of years is still not focusing, is still not reaching those at highest risk. 4% for data and surveillance. We talked about the importance of data. If we can't collect the data, then we can't tell the story. We know Black and brown boys are the ones who are being shot and survivors, but only 12% of the money went to address that. Our children and youth of color, only 7%. The fastest growing demographic of gun suicide right now are Black men. Okay, and they receive less than 1% for firearm suicide. So this funding is still not reaching those most at need and is not having the impact that it could have. Even when they say, oh, this is a health equity focused grant, the funding still is not using a racial equity lens. It's not focused and going to those community involved led research approaches. And the money's not being spread around in the community. 90% went to academia, and actually it was just 3 universities that made up most of that. Nonprofits, it is so few money that is going to the communities most impacted. So we have to change this. And this research was done and funded through the center just to see, how can we make the biggest impact with the money that we have? I talked about philanthropy. They also are missing the mark here and have an opportunity to really fund those who are often not funded. 34% went to one corporation, okay? RAND, research, big corporation. And 39% of the funding went to 7 academic institutions. This is not our community organizations that are getting this money who are doing the programs that we know work for us in our community. So Kaiser Permanente put up $25 million to start this center. And we are really trying to seize the opportunity to just disrupt how the funding is going. We want to focus on funding community organizations at different levels of research readiness, right? We want to bring them along so they can build the evidence to show that their programs are efficient and work. We want to fund researchers of color. We want to look at community-based interventions and firearm suicide interventions that we know work for us. So we do this through research, innovation, education, community solutions. It is all about a racial equity lens. And we're hoping that we can get some of our other colleagues, our other philanthropic organizations to prioritize community-based interventions. So we're giving out money. This month, we have identified 5 scientists of color, a host of other 15 organizations across the US, and giving $2.5 million out the door. Let's get this going right now. In addition, in the fall, we're going to be giving out another $2.5 million to, again, we want early stage, research projects, or maybe an organization doesn't even know what research is. We want to build their capacity to do this, to create the evidence on what works. So again, we're funding community-led, Black and brown researchers, community-driven solutions, health-focused solutions, so that we can really make an impact. The other part that I started with was the narrative change piece, right? We have to change the narrative so that our solutions are top of mind when we're talking about gun violence. We have to start using different language. So we don't want to say, oh, crime-infested area or urban communities. Instead, we talk about communities disproportionately impacted by gun violence because we know that this is structural. We know about structural racism. We need to interject that into the conversation. Don't talk about gangs. Don't talk about thugs, gangbangers, right? Group involved, street affiliated, formerly incarcerated, justice involved. Change how we speak about ourselves. Innocent victims, undeserving victims. I think that is one that really just gets me so upset because all victims are worthy of care. There aren't no undeserving victims. And the last one, Black on Black crime. I'm sure I'm preaching to the choir here. This is a public health emergency and it disproportionately impacts communities of color for all the reasons that I talked about before. We got to do this so that we change the life course for our children. You may see my daughter Avery walking around the conference this weekend. We got to have the public health sector involved. We have to educate public health leaders all of that so that we can get these community solutions up to scale in our communities, focused on those hotspot areas. So that's it. I'll be here. I look forward to seeing you. Thank you. Sure.
Another big hand for Angelina. So how you guys doing? You okay? You feeling good? You getting some knowledge? You got questions? If you have questions, write them down. Take the opportunity to meet with these speakers while they're out in the hallways and have your questions addressed. At this time, we're starting lunch. If you need a moment to stretch your legs or take a bathroom break, by all means do so. Keep in mind that we do have a break heading into the breakout sessions. And while we get started with lunch, we will hear from Dr. Chris Omni to talk about the importance of centering joy for our well-being. Dr. Chris Omni.
Greetings, queens. If you identify as such, greetings, queens. Greetings, my brothers. If you identify as such, greetings, my brothers. Yes, greetings, my queens, spelled Queens or Qwing, to incorporate all of my babies, my soul flowers, no matter if you identify as male or female, however you identify, greetings. My name is Dr. Chris Omni, and I am a Black Joy scholar, artist, and activist. I come from a background of public health with 25 years in focusing on Black women's health and more particular physical activity. But what I started to realize in my research is that I was sending out the deficit narrative, that everything that we've been hearing seems to be kind of heavy. Or is that just me? Okay, so you might be feeling a little bit heavy right now. So some of the statistics that I was sending out while working on my master's thesis was that Black women are 42% more likely to die from cancer. We're 60% more likely to be diabetic, 30% more likely to die from stroke. 80% of us are overweight. 53% of us are obese. So you may know additional statistics, but what started this journey for me was my mama. Because in 2016, I watched my mama take her final breath from a 26-year battle with cancer. And it made me wonder, what else don't I know when it comes to health disparities? But you know what I didn't know is that there were so many people that did not realize that joy is not just our birthright, joy is also a death right. I watched my mama live and die with joy. So some people look at me and say, I'm so sorry for your loss, and it must be awful to watch that final breath. And yes, it was, but it was also a gift. She had people in and out of the house loving up on her, honoring her life, but everybody was gone on that day and she trusted me. So mama saw me take my first breath, and I got to see her take her last breath. So I stand before you today during these next 10 minutes to talk about and have you engage in breath work. So in this space of breath work, I invite you, and I don't know if you can I move this over to the side? I stay barefoot, y'all. I need to be grounded in the space so that the ancestors can come and communicate with me, so they can communicate through me, so that you can hear and see and feel this conversation. And when I use the word ancestors, it's those I met by blood, those I met by bond, but it's my mama who's leading the charge as my main ancestor and cheerleader. So mama is in this space with us, y'all. So in this space of Black joy, you might read it on my shirt, but this is what I said at my last TEDx talk. In order to theorize Black joy, there are 6 pillars. So if any of them resonate with you, and if you like the concept of Black joy, give me a mm-hmm. Oh, that feels good, y'all. You get me started. Either give me a snap or mm-hmm if any of these pillars resonate with you. So here we go. It's a poetic theorization of Black joy. Black joy is a statement. Black joy is a stride. Black joy is permission. Black joy is pride. Black joy is a form of resistance, and Black joy is a form of rest. Black joy is anything and everything you need it to be, because truly, Black joy is the best. Come on. So I bring to you my 25-year background in public health with my foreground in art education to create a healing space around breath work and grounding. So this is now 10 minutes of interaction, because I could talk the whole time, but I would much rather feel the whole time. So if you want to, I invite you to take your shoes off. Some of you are like, they're already off. Some of you are like, I was just waiting for somebody to say, take my shoes off. Your second invitation is, if you are able to and if you want to, I invite you to stand up so that we can fully breathe through all of our chakras. If you know about chakras, it's important to get those aligned and balanced and expand our chakras. And if that's not something that you can do, we can still do this in a seated position. And Queen in the back, I don't know who you are, but you already hit me with the first stretch. I want you to elongate your body. I want you to take up space. Exhale, coming down in that space. If you happen to touch somebody along the way, just say hello. So inhale up. Oh my God, I heard that inhale. Thank you. And exhale down. We are taking up space with our body. We are a beautiful being operating as one with this collective breath. Take it down. Now, in this breath work, if I had enough time, I could run you through all 7 chakras, but I'm going to take you to the heart chakra right now. So if you're familiar with the heart chakra, I would like for you to put your right hand just over your chest and just feel that breath. Don't do anything exceptional. Don't do an intentional hold and release. Just breathe in that space. Think about the language I'm about to share with you. Where attention goes, energy flows. Where attention goes, energy flows. I'm going to stand over to the side for a little bit because I do not like this division. So can y'all hear me in the back? Is that all right? Thank you. With my right hand over my chest, I am closing my eyes to get centered in this moment. I invite you on this journey of centering through our heart chakra. I am moving my dress out of the way so that I can fully be planted with you in this moment.
The energy that you are sending through the ground is coming to me, and the energy I'm sending right back out to you. This, in my research, is what I call the collective self motivation. So as I'm breathing in, I invite you to do the same. And we start right here with the heart chakra mantra. Just breathe as you normally would. And think about the words associated with the mantra. And I'm going to open my eyes just so that I can see the beauty in this room in this moment. But my heart is open to receive the energy of love. I radiate this essence. I walk my path with ease and grace. Ashe. Continue to hold on with your right hand over your heart. Now I'm going to ask you to put your left hand down low in that root chakra. So you might find your belly button, go below your belly button and just hold both of those spaces. You in this moment are giving yourself a hug. When's the last time you had a hug? This morning, I'm gonna let you know when we're done, I'm giving free hugs and they're amazing. You need, and somebody already had a hug from me today, so you feel it, you know what it is, you've had it. So in this moment, you're giving yourself a hug, but we are changing our breath so that where attention goes, energy flows. Focus on your heart right now and just breathe and feel it in your chest. Inhale. Exhale. Again, please. Let your chest rise. Take up space in your own body and let it fall. Now we're going to shift that breath to our root chakra, the place that allows us to be grounded in the work that we have to do today, tomorrow, and the days to come. But as you breathe, because this one up here, you can feel your chest go up and down. Try to change your breath to go to your root. So as you inhale, feel your stomach, feel below your belly button, and then release. It takes a while to engage in the full chakra breath work, but we are just going to stay here for a little bit in the root chakra because this is a moment of grounding in Black joy. Grounding for the work of our ancestors, for the work that we are doing that they were not able to do or they started and they could not finish. We are breathing for them. Now releasing your root chakra, bring both of your hands back to the heart. As I have you for these next 3 minutes, I want you to feel the love. If you saw the shirt I was wearing yesterday, it said, "Dear Black women." It is a love letter to all my queens in the room. I can't see all the way in the back, but in these 3 minutes, I'm going to say, as long as I can see you, I hold you. I love you. I hold you. I love you. I see you. I hold you. I breathe with you. In those moments when you can't breathe for yourself, I breathe for you. I send love, light, and energy to all of you, my queens. And I know that this is a space that is more than just Black women, but I stand true to the space that I research in and I operate in. And the woman who gave me life, who is now the ancestor, my mama. I honor the work of my dad as well, but in this moment, mama said, talk to them. In this moment, mama said, see them, especially the ones who no longer have their mamas, hold them. And that does go for everybody in this space. Releasing the heart chakra, we're going to take up more room as we inhale up. This time, connect your fingers, take up more space, and go higher. Go higher with your work. Go higher with your love. Go higher with your intentions. And release and come down to your side. If you are barefoot, I want you to take this moment to feel where you are, because we are about to stand in silence for this last 60 seconds. This is your moment. I am quiet. I am watching the countdown. Be grounded. All we have is the now. Begin your silence. For another 20 seconds, open your eyes. And I'm not going to have you turn around and say hello to somebody. I want you to say hello to yourself. I want you to say, I love you to yourself. I'm going to come down these stairs and invite you to let me hold you. Hold your hands, hold your shoulders, because my 15 seconds are almost up, but the moment that we exchange a collective breath work, my work continues. I am a healer, and in the space of Black joy, I share that openly and lovingly. So please let me hold you. I invite you up, and I thank you so very much to all of you who gave me a chance to help you through this space. I close with the poetic theorization of Black joy is this. Oh, they gave me more time. Uh-oh. No. Oh. All right, because I honor your time. Black joy is a statement. Black joy is a stride. Black joy is a mission. Black joy is pride. Black joy is a form of resistance.
Thank you, Dr. Chris Omni.